All right, our next category of disorders are eating disorders. You're going to probably be familiar with these from things like health class. We're going to look at them from obviously the psychological perspective. As we take a look, there are three that we're going to see: anorexia, bulimia, and binge eating disorder. These are more disorders that fit into that category of comorbidity. And we said comorbid means that uh, folks have more than one disorder at a time. A lot of times these will be uh, accompanied by other disorders that a therapist will have to help with. Eating disorders, I know this is going to come as an enormous shock to you, are characterized by disturbances in eating behavior. What you're going to see here is we have people that don't eat, we have people that eat and then purge, and we have people that eat too much. And so previously, uh, people kind of the conventional wisdom was that these were very much caused by environmental factors. We do know now that there's definitely some genetic components in there as well, but a lot of it has to do with our ideas of beauty. If you look back at some of the famous paintings that are hanging in the Louvre, you'll see the vision of beauty back then was different than it is now. Um, Figures were usually very pale. Being pale uh, back in olden days meant that you didn't have to work outside, which meant that usually you had more money. Uh, Models are usually a little on the heavier side, and that was simply an indicator that you had enough money to have plenty to eat. And that vision of beauty has really changed, especially in the category of ladies, because now today that being pale, carrying a little bit of weight, that's not going to be uh, the thing that's going to get you on the cover of Vogue or Cosmopolitan, things like that. And so, one of the theories is our idea of beauty has changed. People are willing to more radically take steps to conform to that idea of beauty. The first one, anorexia nervosa, is where patients try to get thin by starving themselves. So these folks are going to eat below, well below what the daily requirement of calories would be. The disorder's more common in females than it is in males, um, but we think now today that a lot of that may be uh, because it's easier, um, or it's not easier necessarily, but uh, females have an easier time talking about it. I've got a great TED talk I'm going to put up uh, on our playlist there on YouTube of a fella who is struggling with an eating disorder, and talking about how that's really an underreported problem with males. Symptoms of anorexia: you weigh 85% of your normal weight. Now that is very very thin. Basically, if you look at what you're supposed to weigh, I would be willing to bet that most of us aren't anywhere close to what the metrics and the measurements say we're supposed to weigh. And if you're at 85% of that weight, um, you're um, very thin. Intense fear of weight gain. So this could be where some of the anxiety is going to come in. Distorted body image. So no matter how thin they get, they still see themselves as fat, which is kind of like what we saw with body dysmorphic disorder in the somatoform category. Biggest physical symptom that people get is, ladies will get, is amenorrhea. That is the absence of a period. Body actually gets so thin that that women will stop having a period. Now, to treat anorexia nervosa, you're going to have to get a couple of things, a couple of different groups that are going to be in there. Obviously, you need a medical doctor. There are going to be some problems from this malnutrition that are going to need to be treated. You're going to need to bring in a therapist to help with the thoughts that are driving this disorder. And usually a nutritionist needs to be brought in as these people are encouraged to uh, form more healthy habits and to get healthier from from these issues. That team working together is really what's going to help. A lot of times they'll have patients keep food diaries, things like that, as they attempt to talk. So that's anorexia. The second one, bulimia, is very similar. You still have a pursuit of thinness, but what will happen is these people will eat. They'll binge eat, and then they find a way to purge that food from their body. A lot of times with this one, we think of people who throw up after they eat, and that is certainly part of bulimia. One that you don't think about a whole lot is there's also a segment who take laxatives to speed that food through the system as fast as it can get through, again, in an attempt to pursue thinness. And so either one of those counts as a purging type of behavior. You've got all the same effects that you've got with anorexia, but you've got physical issues that come from the purging. Sore throat, obviously, from that nasty stuff that comes up from your stomach as you throw up. These people can have kidney issues from the stress that's being put on their body with some of the things that they're taking. They can become dehydrated. They can also start to wear off the enamel of their teeth, that nasty acid that's in your stomach. Uh, can start to do uh, to do that as well. And so you see even more physical issues with the purging type of behavior. Again, you're going to assemble that same team to help these people figure out physically and mentally how they can craft and create better habits, healthier habits that are going to uh, be able to get them where they need to be. Third type is binge eating disorder. This is kind of the exact opposite. These folks will overeat. Um, some people estimate maybe up to 5% of the population of the United States suffers from some type of binge eating disorder, and it's recurring episodes of overeating. Now, this is not, mom fixes your favorite meal and you go back for thirds. Uh, this is recurring episodes of eating. These people are not purging. Usually, there's a lot of weight gain that will eventually come with this one. They eat really fast and they eat to the point where they're very uncomfortable. And again, how do you treat this? Well, you got to figure out um, what's the food, what psychological need is that food filling? And so again, you're working with a therapist, you're working with a medical doctor, but this time not working on the problems of thinness, but of things like heart disease, the problems that'll come along with weight gain, diabetes, things like that. But also with a nutritionist saying, hey, here's what a portion is, and this is what uh, we need to have some healthier habits there to help these types of patients that'll go through. But these are pretty common disorders, ones that you'll see out there quite a bit. But again, just that idea that that these are problems that all center around eating.